is Nick Hunter. This is skill number 21. This is applying an otic medication to a cat. So some things I want to make sure that I do before I do anything else would be to have the medication I need handy. Get some cotton balls or some gauze that's just dry at this point. And then of course having somebody else help restrain the cat so that when I'm in his ears he doesn't have necessarily a chance to bite me. For this guy, he's going to get some Tresiderm in his ears. The first thing I'm going to do before I apply any medication though is just take a dry cotton ball or a piece of gauze and just make sure that any leftover debris, any leftover medication from a previous dose is wiped out and the ears are nice and dry and clean. So for him, he's got pretty tiny ears. So cotton ball's a little big. If it's a little too big, you can always stretch them out or tear them up and get them a little bit smaller. But all I'm doing is just sticking that in his ear. And with that, I can't hurt his ear canal. The shape of the ear canal is in an L, so I can't get down there to hurt his eardrum. But I do just want to make sure they're dry. And then once they're dry, we'll go ahead and apply some medication in there. For him, it's going to be just one drop in the ear. And so when I go to do this, I want to make sure that I don't try to jam the bottle down into his ears. That's not necessary. You can just tip the bottle and drop a drop or two or however many you need into the ears. So for him, we're just going to tilt his head slightly, tip the bottle up, and then just give it one squeeze, and then one drop will fall in. Once the medication's in the ear, you want to massage the ears, kind of help that medication work its way down into the ear canal. And he may shake a little bit, but that's normal. And then, so you would do the same thing on the other side. The other thing you want to keep in mind is anytime you use a medication where it's kind of in the ear canal, go ahead and just wipe the tip so that we're not transferring anything from one ear to the other. And so just like before, I'm just going to take a dry cotton ball and kind of make sure that the other ear, right here, is dry, that any old debris, any old medication is no longer in there. And as long as that's all said and done, we can move on to putting some medication in there. Just like this, on the left ear, it's going to be just one drop. So I make sure that I don't really try to squeeze it way down far in his ear, just enough to get it in there and it can work its way in. So we'll drop one drop in, and then we'll massage the ear canal, and we'll get both of them again. And then he may shake, but he's good to go. And then just make sure that you wipe the tip of the medication bottle again. That way you're not keeping any old dirty germs medication on. That's it. Alright, my name is Nick Hunter. This is skill 21. This is applying an otic medication to a dog. So just like with the cat, I want to make sure I have everything I need available before I get started. So the things I really need is the medication. For him, it's going to be Momedimax, just some dry gauze or some dry cotton balls. What we're going to do is make sure that the ears are nice and dry and clean before we apply any new medication to them. So that means any old medication, any discharge in the ears. We're going to make sure we get that all out before we put anything new in. So what I'm going to do is just take a dry piece of gauze. And we're going to wipe out this ear first. Just make sure that there's nothing in there so that we're not putting any medication on something old and we're not actually treating the problem. For him, his ears aren't too bad. So make sure you get all the little crevices in his ear as well. You can't get to the eardrums, so don't worry about getting too far, but just be careful about being too rough with their ears. The ear canal is in the shape of an L, so the eardrum is at the bottom of the L, so you can't quite reach that. So now that everything's kind of cleaned out, it's nice and dry, we're going to apply some Momedimax to his ears. This medication does have quite a long tip on it. You don't actually have to place the tip way down in the ear canal. You can just keep it right outside the ear and just squeeze the bottle, and a drop will fall out as you squeeze the bottle. One thing you want to try to avoid is when the bottle gets closer to being empty, make sure that the medication is ready to squirt out. So that when you do squirt it, you don't do this really loud squeeze of air into their ears and scare them. So you always want to make sure that it's ready to come out. For him, I'm just going to flip the ear up, keep the pinna up, and then we're going to place a couple drops in the ear. Okay. Now that those are in the ear, just going to massage sure that medication works its way down inside. And then he'll be good on that side. One thing you want to make sure with the tips of the medication bottles is just wipe them off in between ears so that we're not transferring any kind of bacteria or any discharge down from one ear to the next. And Rex, can you come here, bud? Just like before, we're going to make sure that the ear is nice, dry, and clean. I'm going to take a piece of gauze and just wipe the ear out. And then from there, once again, just make sure the medication's towards the end of the bottle so that you're not squeezing air in his ears. Not going to place the tip of the medication into his ear either. I'm just going to keep it right outside his ear canal. Okay. Once that's in, you just want to squeeze around the ear again and massage that medication in. And you can go back and massage him at the same time. And then he should be good. Just make sure you wipe off the tip of the medication bottle again, and then that's putting ear medications into the dog's ears.